was said.
Well, very interesting, Aisling. Professor Smith, she started the job yesterday, asked today about the isolation period. So as we know, if somebody gets a positive COVID test, they're now isolating for up to 7 days. But Breda Smith saying today, you don't necessarily need to take a test. She's saying that actually, if you have COVID symptoms, you should stay at home, treat those symptoms and stay at home until up to 48 hours after those symptoms have cleared. Tests, she says, now are reserved for people who are most vulnerable, who have medical underlying health conditions. But for those of us who may have been taking antigen tests at home, she's saying maybe that's not necessarily needed at this stage of the pandemic. We asked her as well today, for example, anyone who might be serial testing themselves, if they're for any particular reason taking antigen tests on a weekly basis and they throw up a positive result but they're completely asymptomatic. She says, well look, if you take the test and you have a positive result, you stay at home for 7 days, but if you don't take the test, then there's really no reason to stay at home. It's just an interesting change of messaging, Aisling, from the Department of Health and from this new acting Chief Medical Officer, who tells us today that we're now in an endemic phase of the pandemic.
The infection is now, or the virus is widespread. So that's why it's not important to identify every single case. It may be for our own personal knowledge, but it's not essential from a control and management perspective to identify every single case. And that's why it's not necessary for everybody to take an antigen test. But I understand if people like to do so, that's personal choice and they're available freely for people to do so.
Well, Aisling, this will be of particular interest to businesses who are struggling to keep their doors open at the moment as we deal with another surge of COVID-19 cases. 849 COVID patients in hospital now, but we understand that just half of those are in hospital because they have COVID, as opposed to half discovering they have COVID upon admission to hospital. So interesting messaging from the Acting Chief Medical Officer, Professor Breda Smith. Separately, the Health Minister, Stephen Donnelly, speaking this morning, saying that the country remains on course in terms of their targets to clear hospital waiting times. He says that does remain on course, but he says that COVID-19 obviously does remain a risk to that. But he says if they were to keep going towards the target, Ireland would see the waiting list at the lowest they've ever been by the end of the year.
Zara, thank you very much for that.